Okay, great. All right. So again, thank you for joining us today. This is the second of our health literacy series. And this one is called Writing Clear Health Materials, Best Practices for Using Plain Language in Your Print and Digital Materials. This program is supported by the Office of Minority Health, and we are thankful to them for supporting this. So let me introduce myself. I'm Lisa Carey. I'm the Senior Health Literacy Writer and Training Manager at Health Literacy Media, or HLM for short. And I'll let my co-presenter introduce herself and tell you a little bit about HLM.
Hey everyone, I know that my name says Ariane Hairston. My name is actually Megan Rooney. I'm sorry, I'm logged in our as our company HR representative today. But it is, I'm the Director of Program Development at Health Literacy Media. And we have been working with the Kansas City Health Department for a few months now on a large health literacy project. A piece of that is presenting several different trainings for you all in the Kansas City, greater Kansas City area on different health literacy topics. And here at Health Literacy Media, what we do really is make health communications clearer for people in many different ways. That could be a piece of writing, that could be developing a website, that could be policies, making policies clearer for patients to read and community members. We've been doing a lot of COVID work, as you might imagine, recently. So how do we combat misinformation? How do we communicate this important information clearly? And so today our training is going to be about writing. We also are going to be doing trainings in the future about verbal communication, how to have clearer conversations with people, specifically around COVID. But these principles apply to general health communication as well. Today's topic is writing clear material. So it looks like a lot of you are in clinical work, so you work with patients, but I do see some community organizations listed here. So a wide range of roles. So this can apply to patients that you work with, community health workers who are out speaking with community members. It can really, we might say patients or clients in here, but it really can apply to all of your work and whoever the end user is for your communications. Lastly, Lisa, I do want to mention that we can see the speaking notes on the slide. So I think that the presenter mode is not in full effect.
Okay, I'll share my other screen.
Okay, see if we can fix that real quick.
Yeah. Okay, is that better?
That is better, thank you.
Okay, great. All right, so thank you. Let's go ahead and, all right. So before we start, we just want to let you know a few things about the training. Your audio is muted to lower background noise. However, if you want to participate, feel free to turn your camera and your audio on and speak up. We also, want you to use the chat box and participate as much as you can. We want it to be very interactive. At the end of the training, we're going to ask you to just fill out a short survey. And then in the next day or two, we're going to send you a summary of the concepts that we're talking about today, as well as some like health literacy and plain language resources that we show at the end of this training. This training is 1 hour long, and let's go ahead and get started. Okay, so here's our agenda. First, we'll define health literacy in plain language. Then we'll show some insights on how people read, especially readers who have low literacy. Next, we'll go to the tips for writing clear health information. And finally, we'll show those health literacy and plain language resources to you. Okay, without further ado, let's get started. So we covered the definition of health literacy in our first training last month. We're not sure how many of you were able to join us for that, so we're going to just quickly review. There are two different types of health literacy, and we'll let you read these about personal and organizational health literacy. Okay, so basically, at the individual level, it's about how people use and understand health information that they get from doctors, hospitals, health systems. And then at the organizational level, it's the system level. And this is where health inequality and bias can operate. It's about how organizations, how health professionals, like all of us, help people navigate healthcare and make good health decisions. So what does health literacy look like? In real life, health literacy involves, things like making decisions about health, such as getting vaccinated. It also can mean something like understanding information about safe behaviors, such as being able to listen and understand written and verbal instructions for medicine, recognizing symptoms and how to get tested in the case of COVID. And also distinguishing between fact and misinformation related to health myths. Especially, we've seen that during this COVID-19 pandemic, and that misinformation is rampant. So helping patients understand those differences is crucial, and part of what we're kind of talking about today. Also, navigating healthcare systems is a huge part of accessing care, such as appointment scheduling, telehealth, and other technology. As we go through these slides, think about how health literacy has impacted your life or your work, such as, response to COVID-19 at either your individual level, your family level, or your organizational level. Okay, here's our first activity. How do we use health literacy in daily life? So in the chat box, type some ways that you or others use health literacy as part of daily life, either, individually or in your organization. Understanding medicine usage, reading posts on social media. Yeah, Katie says, understanding when my next appointment is and what it's for. Erica, caregiving, making sure my mom understands instructions. Terry says, nutrition labels. Kathleen says, I use it to help seniors understand preventive care. Wen says, education material written in plain language. Great. Okay. Gigi, to make sure information is clear to family and those I speak with in the community. Emily says, knowing how to describe my symptoms. Yeah, great. Debbie, working with health profession students who are working with volunteer patients. Okay, great. Oh, one more. Chad, providing homeowners with reports with technical data. Okay. Wonderful. So how does that look? Okay, you all already did that. Here's some things that we thought of. Scheduling a doctor or specialist appointment, maybe understanding how much pain reliever to give a child for a headache, paying a doctor bill, recognizing symptoms, somebody mentioned that, knowing when to test for COVID-19, and also, at a higher level, being able to distinguish between low and high risk situations. And we can see how health literacy really infuses our daily lives. Having low health literacy can cause, daily problems and barriers in so many different ways. Okay, so that's kind of our look at health literacy and how it affects us daily. Now let's take a little look at how people read, especially those with low literacy. So we touched on this a little bit in last month's training, but it really does bear repeating. In the US, the average adult reads at about an 8th grade level, which is about 13 to 14 years old. However, what people actually understand may fall 2 to 3 grade levels below that. And the problem is that most health materials are written at about an 11th grade level. So you can see the mismatch there. The National Institutes of Health recommends that patient health materials be written at no more than a 6th grade reading level so that you're sure to catch everyone. Readers with limited literacy skills may describe themselves as reading well. However, data from eye tracking and usability studies paint a much different picture. Readers with limited literacy skills have more problems with memory. They may struggle to decode challenging words and remember what they mean. And then, if a material or web page has a large amount of content, users may struggle to remember it. And then studies find that what they do remember may not be the most important information. So to compensate, we've found that readers with limited literacy skills in general may read more slowly, and they may reread words, sections, or elements on a website, like buttons or menus, just trying to understand what they're seeing. They may skip words or whole sections, or start reading in the middle of a paragraph. And then some may try to read every word because they can't effectively skim through and draw meaning from the content. And this is more common when people are reading something that when they feel the stakes are high, like a loved one has just gotten a cancer diagnosis and they're trying to read information about that type of cancer online. So they may reread and reread. So here's kind of an interesting thing that shows eye tracking. These are 2 different examples for eye tracking for a user with low literacy. And these show actually the same web content, but it's the one on the left is before plain language revision, and the one on the right is after revision. So I don't know if you are familiar with eye tracking studies, but they measure the focus and the motion actually of a person's eye as they're looking at a web page. And so, in each little dot there is a place where the eye is resting, and they have little tiny numbers on them so they can even, tell the kind of the sequence of where their eye was resting. It helps us understand both how users read and how they search for information online. So in the chat, tell us what are some of the differences that you see between these 2 different eye patterns? What are things that you notice about them? The number of stops. Yeah, Vi says follows a more direct pattern. Gaze is more focused in the after version. Plain language is more in order. Eyes going back to reread materials. Yeah, on the left. Sabrina says it's focused more. Debbie says eye movements are more concise in the after version. Yeah. That's the idea. It's less frenzied. The after version is more, sort of, you can see that they're not as frenetic. You will notice too, or I noticed that they're kind of moving down that middle section that's bulleted, and, as opposed to the more sort of dense text over to the right. So that's one thing that we'll cover. The evidence-based strategies that help your users find and understand the information they're looking for. And, we'll talk a little bit about designing a home page so that your eyes are drawn to easy navigational elements. Another thing that we know is that people may hide their lack of understanding from you. There's shame that goes along with not being able to read well. And studies find that, 1 in 2 adults with low health literacy are already ashamed of their reading ability. So they will try and hide it from you. The good news is that by using health literate communication tools, you can help your clients understand complex information and really enable them to make those good decisions for their health, no matter what their level of health literacy is. So I'm going to turn this over now to Megan.
Hi, everyone. Thank you so much for being interactive with us today. It will help us kind of stay focused and connected during the training. I am going to start to move into the actual tips. And so we covered some of these in last month's training, but we'll get a little bit more in depth here. So plain language isn't just about words. One of the guiding principles of health literacy is plain language. So people use them kind of interchangeably, but plain language is a set of evidence-based strategies that can make a huge difference in creating a material or revising a material and help people understand and act on information, which is usually the goal of health information. Hopefully some of you see a little reactions button down at the bottom of your Zoom screen. Raise your hand, or you can physically raise your hand, if you've tried to simplify a material or tried to write in plain language. And it does look like some of you have plain language in your background, so I'd imagine some of you have. The count is going up. I see like 10, let me see, 15, 16. Yeah, okay. So a lot of you have raised your hand. Thank you for, I see some claps. Okay, now they've changed to hands. But it looks like it looks like a good amount of you have tried to use plain language strategies, and a lot of you might be well versed in them. And hopefully you do pick up a few more tips today. And in plain language, when we say that, it's a little bit of a misnomer. It's not really just about language. It's also about how you structure your material, what the scope is, how much information are you providing? Is it too much? Is it too little? How are you designing it? Is it overwhelmingly visual? How do you kind of balance text and visuals? How do you speak to your specific audience, given their background, their culture, their reading ability? And so this is a draft version of a material of educational content. Lisa, you can go ahead and click for the final. So this is with a university partner here in St. Louis. This was the cover page of our revision. And so it was a booklet and it goes on, but you can see the, the difference when using plain language principles from the left to the right. Less words, more visuals. So here are the 6 tips that we will cover, and I will try to move pretty quickly because we do have a lot to cover. The first thing to think about when you're starting to write a piece or you're revising something is who is your audience and what really is your purpose? And everything you include should be connected to those two questions. So we'd love to hear who you serve. I'm going to pull up a poll. Now, hopefully this pops up on your screen, and we'd like to know who you serve. So here's a list of possible audiences. There's an option for a different population at the end in case you serve a different group. So go ahead and click through this. And I'm sorry if we didn't cover your community and those you serve. We tried to include a variety. Okay, I see the numbers coming in. A lot of people serve the general public, parents and families, communities of specific racial and ethnic backgrounds, refugee immigrants. Okay, it looks like all the categories have some, have some responses. Okay, great. Thank you. I see the numbers coming in. I'm going to end the poll, but I'll share the results with you all. So thank you for that. Hopefully you can see these numbers here. So the general public, it looks like a lot of you, almost majority of you do serve the general public, a lot parents and families, children, specific racial and ethnic backgrounds, refugee and immigrants, also the LGBTQ community, rural populations, and then there are some different groups that we didn't cover in our poll. Okay, great. So that's the goal, when you're starting a piece is who is this for? What is this about? Okay, Lisa, you can click ahead, thanks. Let's talk a little bit more about audience. So health literacy is not writing so that everyone can understand. It's writing so that your specific intended audience can understand. And it's about what they want to know, not what we want them to know. Now think a little deeper about your audience as you're thinking about the materials that you create, the writing you do. You want to ask yourself, what is their age, race, ethnicity, profession? Lisa, you can click through these.
Yeah.
Click. Okay, there we go.
Yeah.
Demographics. What are their perceptions of the risk, possibly of COVID, if that's what you're writing about? What are their attitudes towards things like vaccines? What motivates them? What is their socio-cultural context? And then do they have specific needs? Does this tend to be a low literacy audience? Is there a language barrier? Are there religious or specific spiritual concerns to take into account? Geographic area, such as rural versus urban or suburban. These are all the things to be making notes about and be really thinking through as you're developing your content. And in addition to audience, I mentioned purpose. So you want your purpose to be clear at first glance. Here's an example. The title on this document says National Violent Death Reporting System Background Document. So basically it's a background document. What does that mean? So here's a revision of that. And you'll see that the title and the subtitle state it specifically what it is. It's a powerful tool for prevention. It's a reporting system. The purple intro paragraph tells more about what the reporting system does. So that's really getting at what is the purpose of this material and this reporting system. Also says who it's for, what it benefits. So you can see that the audience, the purpose is much clearer when you just state it up front, using a clear paragraph, a clear title, and often a clear visual as well. And this helps people, recognize that this might be for them. Oh, this is a topic I care about. Otherwise, if you're using a very general heading or title, like, general information about this, it's, it doesn't feel like people relate to it. It doesn't feel like it's made for them. So we are going to do a quick activity. And this one, we're just going to do on the screen. So we'll show you two examples from the Kansas City Health Department website. And so often we pull from the clients we work with, and this is not to, diminish the work or anything. This is really to make it more relevant to you. We're going to assess the purpose and the audience for this one. So Lisa, can you click to show the 2 questions to think about? So as you read through this paragraph, think about what is the purpose and who is the audience, and feel free to type that in the chat. So you put yourself in the shoes of someone who comes across this on the health department website. Someone says possibly health providers being the audience. It's really not quite clear who the audience is, I think. General public, possibly. Yeah. So the purpose is not clear. The audience is not clear. Not clear is what Rena says. It also includes some jargon terms like vigilance. It's really hard to tell. So if we look at example 2, here's a different example. Think about purpose and audience of this one. The health department brings COVID and flu vaccines to downtown Kansas City. Residents, downtown residents. Yeah, general public. Yeah, so this one makes the purpose and audience much clearer. It could even go a step further and actually say the audience, which is a fine thing to do. Do you live in downtown Kansas City? Do you live near Kansas City? This information is for you. Just even something as simple as that. Now we're going to move on to structure. So this is our second tip, making your content easy to navigate. This is one of the most important principles, I would say, and I've been working in health literacy for close to 20 years. It's really hard to get right, but really it's all about organizing your information. What information are you including and where are you putting it? On each page and in each section, you want to put the most important information first, because many readers are going to look at it, decide if it's for them, and move on, or they're going to skim it. And so if they see that first point that really sticks out as important to them, you're more likely to have them stick with it. Then you want the least important information to appear last. So you also want to include to consider what you're including. And this is the need, we call this the need to know information. So what are the points you really need people to know about the topic? And then what are points that are kind of nice to know, but they might not actually need it. And so if you're ever looking to cut content or decide what you're going to include, really think about, with that really critical eye, what's kind of just nice to know. Usually it's prevalence data, dates, things were created or established. People really want to skim and they want little bite-sized pieces of information, especially online. So it's really about getting at what's essential and what are the action steps. Here's our next activity. I am going to pull up a new little activity for you. So read through these 4 statements, and these are all about scheduling a telehealth appointment. And then choose which one you think should go first. I'll give you a minute. Okay. I see the results coming in. A lot of people are saying the third one. It looks like most people are saying the third. Some are saying the second, which is the action step. So call the clinic. And then some people are choosing number 1, which is You'll need a device with a working camera, which is essential information. I'm going to go ahead and share the results with you. Majority of you said to define telehealth, and we would agree with that. You first want to define what the topic is. There you go. What the topic is. So telehealth, it is actually jargon. A lot of people are aware of it, but a lot of people aren't. So Lisa, you can go ahead and click, and we've kind of revised how these statements would appear. So correct if you said C. You want to say what is telehealth first, and then you want to get to some of the other details. It's debatable whether you want to put B second or later, that depending on your context. Another tip here is using reader questions as headings. So let's say one day you are tasked with writing information about a new policy that allows people to bring their children for lead testing. So you're looking at this big blank page of information. So you're going to start by thinking about what are some of the questions this audience has about the program. What are some of those questions? What might people want to know? And who is the audience? So think through that. If you feel like writing some of that in the chat, I'll give you a minute. So Alma says, what is lead? So meaning like maybe what's the lead going to be? What's your first statement? How are you going to draw people in? Is your home safe from lead? What is the first sign of poisoning? Yeah. So these are all good ideas. Why would I want testing? How do you get it? So getting right to the action step. And it really all does depend on who is your audience and how are they getting this? Is it a pamphlet? Is it a text message? It all depends, but it's good to be thinking this way. So here's let's see, where am I? Here's a screenshot of the Kansas City Health Department web page about childhood lead poisoning. So you can see it uses a couple of reader questions, which is a great strategy. So what can these programs do for me? What if I think my home has lead paint? So that's great. Those are great questions. Questions can draw people in as opposed to just statements in titles. Here's some questions we came up with. So what is lead poisoning? Might be kind of as the example before, you might want to define it. A lot of us know what it is, but if if your education level is low, if you are new to the United States, you're from another culture, another country that maybe didn't have the public health infrastructure, what is lead poisoning? And then a subhead might be, what is testing for it? How can my children get tested? What if the test shows that they're positive? What about my home? And then what if I have questions? So that's just something we came up with, if say you're speaking to the general public about lead poisoning. So again, just really thinking about what your audience needs. Big, bold headings are really helpful. You can see here that there's a main heading, there are headings, and then there's subheadings. So those levels of information help people skim. And we know now from a lot of research in this digital age that people skim. They often don't sit down with a piece and read from beginning to end. They just are skimming for what information is important to them and whether they're going to continue reading or not. So that's what makes headings and subheadings really important. It also shows them how information relates to the next piece and helps organize the information for readers so they don't have to do the work of organizing it themselves. The next tip is bullets. Everybody loves bullets, as shown in this document. Everybody loves to just put things in bullets. But there's actually strategy to using bullets correctly. What are your first reactions when you see this list? Do you like it? Do you not like it? What's wrong with it? What's going well? Lots of information, too crowded, too long, too busy, too many words per bullet. I would agree with that. You want your bullets to just be kind of punchy and short. If it's a paragraph, make it a paragraph. Don't put it into bullet form. Debbie wouldn't read it. A lot of people wouldn't read it. Too many words. Yeah. exactly. So you get it. A better strategy would be to use headings. So this is still a lot of bullets, and some of the bullets still have a lot of words. So there's probably more work to be done here. But by breaking it up by content area, organizing it in chunks, we always talk about chunks, that can help people skim and say, okay, what's this section about? What's this section about? What's this about? What do I care about? So that at least helps people organize the information in their mind. You're doing that work for them. So even if you can't, we often work on policy documents or legal documents. We can't change a lot of the words, but there are things you can do structurally to just help people move through it more easily. And a couple tips, more specific tips about bullets. You want to limit lists to 3 to 5 items. There's a reason phone numbers are broken up by 3 and then 4 numbers. That's based on a lot of brain science from a long time ago. People tend to kind of max out how much information they can remember and process at about 3 to 5 items. So if you're getting a longer list, you want to see, and how can I break this up into further smaller lists? Each bullet should be 1 to 2 phrases, not paragraphs. And then you also want to use numbers if it's a sequential list, like steps in a specific order. And I think we have an example of that here. This is, of course, difficult for people to understand when to get their vaccines, understandably. Get your first one 4 weeks later, 6 months later. So putting that in a numbered list instead of a bulleted list can help people understand that it's steps in a process. We're going to now move on to our third tip. I know we're moving quickly. As Lisa mentioned, we will be sending a summary sheet that has a lot of these principles on it. This is kind of the what most people think of when they think of plain language or health literacy. You want to aim for the 8th grade reading level. The average reading level in the US is about 7th to 8th grade. So we're talking about 13, 14 years old. We know that people read lower when they're under stress. So when you're writing your documents, a great way is to check your reading level. And there are settings in Microsoft Word where you can check your reading level. A lot of you might know about that. It's different depending on which version of Word you have. So we showed an example here. And we're not going to get into the steps of that, but in the summary sheet we send, we do add a little bit more information about that. So this just gives you a general sense of where are my words? Am I way too high, or am I, kind of aiming a little bit more appropriately for my readers? I'm going to pull up another activity. This one is about replacing jargon. So I heard someone earlier say something about billion-dollar words, something in the chat. So this is something that we spend a lot of time doing, is how do we break down these really complex words, and what is jargon and what isn't? A good strategy is just to think, if I'm questioning a word, if I'm questioning if a word is jargon or not, it probably is. It probably needs to be described or defined or replaced. Some words people need to know. Glucose, probably people with diabetes need to know that. You might not want to replace it with blood sugar all the time if it's a term they might hear in the healthcare environment. So, you could define it. And so I'm going to launch a poll for you to do a little practice replacing these terms. You can go ahead and just type in how you might replace it or how you might define it. I see people are thinking hard. So the answers are just starting to come in. Someone is saying they're not getting the poll. It could be an older version of Zoom that you're using. Sometimes it won't pop up if you're not in the latest version. or there could be another issue going on. But the activity is just to work on these 3 terms, how they would replace them. So I'm going to go ahead and end the poll so we can keep moving. And it looks like, let's see, I don't think I can see everyone's answers, so sorry about that. But here's how we would work with these 3 words. Lisa, you can go ahead and show the answers. So glucose, you might say blood sugar, or you might define it behind glucose if you feel like they're going to need to know that word. On behalf of, there's a lot of phrases that use a lot of words. You can actually just say 1 word in replacement, like for. Transmission, spread. So there's a lot of use of the word transmission lately. Probably not a word people need to know. There's a simple replacement, which is spread. And then the next slide, we'll look at this kind of complex paragraph that is about COVID, which does contain a lot of complex information. There's jargon that makes it hard for people to understand. So just kind of look through that and think about what are some of the terms that people might not understand. You know, this is something that someone might see on the CDC website. You know, this is typical writing right now. And it might be easy for us as health professionals and people working in health to understand, but when you really think about it, there's a lot of jargon in here. Lisa, you can go ahead and click through it. So quarantine, maximum incubation period, impose, burdens. Yeah, burdens is a vague word. What are the burdens? Economic hardship, what does that mean? Compliance, even the word reduce can be difficult. These words also have kind of a tone that's not extremely welcoming or inviting or friendly, such as the word compliance. So here's how we might revise it. And then Lisa, you can kind of click through and show how we worked with some of these terms. So instead of quarantine, we actually defined it. So stay away from all other people. And we mentioned the word quarantine. Longest time it takes for maximum incubation period. Person's health and earnings instead of economic hardship. Follow the rules instead of compliance. Shorten the time instead of reduce. Great. We're going to move now to active and passive voice. Do a lot of you, I can see some of you on camera, do a lot of you know what this means? Active, passive voice? Okay, I see head nods. Okay, and then I can't see a lot of you. But anyway, you might remember this from like school a long time ago. So active voice is when the person or the object doing the action comes before the verb. And this might sound like really kind of technical grammatical stuff, but it actually is really important, and it helps people. It helps people with low literacy because this is the way in English, at least, that we read and that we speak. We talk about how people do things. So in this example, you see this is in passive voice. So strategies have been followed by many writers. The actor is at the end. And then how you might revise this is many writers have followed these strategies. So you're putting that actor up front and then following it with the verb. And then another example is the webinar has been presented. There's no actor even stated here. So you might revise that with the writer presented the webinar. So always going from actor to verb. So we have a quick activity here about passive and active. I'm going to launch a little quiz. You can read through these 3 examples and then choose whether you think they're written in active or passive. I see results coming in. We're kind of even on everything. We're getting, people are kind of, yeah, I think we're, Give it a couple more seconds to even out. Okay, I'm going to go ahead and end the poll. I'm going to share the results. And so the first sentence here, the test can be found at your local pharmacy, is passive, and majority of you got that correct. The test can be found. Well, who can find it? So the verb is find. So who's doing the finding? The revision might be, you can find the test at your local pharmacy. That would make it active. So when that actor is not present, that's passive. The second one, your local pharmacy has the test. A lot of you chose active, that's correct. The pharmacy has the test. So the actor is the pharmacy, the verb is has. I feel like an English teacher right now. And then the third one, a lot of you got correct, which is also active. You can find the test. So you are the actor, find is the verb. And the reason this is so important is because active can reduce wordiness as well. So you can see how that first sentence is a lot longer because you've got can be found. You can get rid of a lot of words, which can really help readers if you use active voice. It's much more direct style of writing. It's also just the way we speak. You know, if you're struggling with a phrase or with a piece, you know, think about how would I say this? Most likely you would say, well, you can find it at your local pharmacy. Okay. I think that is it for the section on content. So that's what we wanted to cover as far as, you know, the content and the words you're using. I'm going to pass this over to Lisa to go ahead and finish us up, and we're going to move on to clear numbers.
Okay.
Go right ahead, Lisa.
Thanks, Megan. All right, so numbers. Sometimes we don't think about numbers. We're more concerned with the words, but we're going to talk just a little bit about using clear numbers so that they have meaning for people who are reading your materials. And this includes 3 main strategies, and we'll talk about each of these in turn. Okay, so the first one is to use only numbers that are really necessary, such as numbers that will help readers make a decision or help them take action. Don't ignore numbers. Instead, kind of think back to your purpose and your audience as the first thing that you do in this process, and then decide which numbers will be helpful for your audience. So let's look at some examples. Here's one, and this is a Medicaid letter about choosing a primary care doctor, and it tells how many American adults had contact with their doctor or other health professional in a certain year. Would you say that this number is necessary for people who are choosing a primary care doctor? Okay, I'm getting some no's. One person said yes. Okay. We're getting mostly no's. Yeah, and that's correct. We would say no, it doesn't help the recipients of the letter make a decision or motivate them to take action. Let's look at another example. These are graphs from an informed consent form that illustrate how many people bleed or, you know, get a hole in their intestine when they have this procedure that this consent is for. So put yourself in the place of someone who's about to get surgery or is considering surgery, and you're looking at a consent form. Would you say that you would want to know these numbers? Okay, I'm getting yes. So one person said no, but mostly yeses. Yeah, and we would agree. We would say, yes, you know, these are numbers because that are necessary because they help patients understand the risks that are associated with the procedure that they're about to get. And it's important for them to know those risks before they agree to have the surgery. Okay, good job. So the second principle that we talk about with numbers is to do the math for your audience. Readers are just unlikely to want to do even basic math because, you know, for most of us, it's been a while since we've had a math class. So, you know, go ahead and if you can, do the math for your readers when you can. When you can't, like, for instance, if you had maybe a chart and they would need to plug in a number that's individual to them, like such as their weight, you can help that by showing an example and explaining how to do the math so they can do that math on their own. But like, if you can, if it's numbers that applies to all your readers, go ahead and, you know, show how you did the math. This example right here is for children in Missouri who, because of the pandemic, were missing out on their free and reduced price lunches whenever their schools were closed due to the pandemic. And so families receiving SNAP food assistance benefits got an extra, what they call, you know, pandemic EBT or PEBT during this time, since they were having to feed their lunch to their children at home. So on its website, the Missouri Family Support Division did a good job of showing how these PEBT benefit amounts were calculated. They showed the cost of free and reduced lunches multiplied by the average days of school closures in March through May and came up with the total number. Okay, and our third strategy with numbers is to use natural frequencies and percentages. A lot of times, you know, the default is just to use percentages. Natural frequency is like 1 out of 3 or 1 in 3 people. Research shows that natural frequencies may help people understand because they give context and imagery. A lot of times, you know, it's good to use these sort of, these people icons, you know, the bathroom sign icons, where percentages are somewhat abstract. It's really good to use those natural frequencies. On the other hand, some research suggests that readers with low numeracy may interpret numbers as more risky when they see it, you know, as a natural frequency, 1 out of 3, as opposed to seeing a percentage of 30%. You know, it could be because these frequencies elicit more emotional imagery, whereas the percentages are a little more abstract. We're not sure, but when possible, what we like to do is to use both, such as, you know, 30% of people will have cancer during their lifetime. That means that 1 out of 3 people will have this health condition. If you can use both, go for it. We do have one more little tip for written materials. For the numbers 2 and above, use numerals. I know most of us were taught that you would use, you know, you would spell out as words the numbers 1 through 10 or 1 through 9, and then use numerals for 10 and above. But really, you know, studies show that numerals stand out more from the text that's around them. And so, you know, go ahead and use them all except for 0 and 1. A 0 can be misinterpreted as an uppercase O. A 1 may look like a lowercase l, unless, you know, if you're showing them around other numbers, go ahead and use numerals for those as well. And this will be in the summary that we send to you. Okay, so our fourth and final strategy is all about leading your reader to where you want them to go through specific action steps. So, you know, we want them vague actions such as use a clean face mask. It's, better than nothing, but, these vague instructions are all too common these days. And so how could you, in the chat, show how could you make these instructions more specific on what people should do instead of just use a clean face mask? Okay, daily. Great. Okay, I'm going to go ahead and show you something more like wash a reusable face mask once a day, throw away disposable face masks after wearing once. Yeah, and then stay away from other people if you have COVID-19. Could be something more like this, stay in a specific room, wear your mask when you leave the room. You want these actions to be successfully carried out. So it's a good idea to be as specific as possible. We do have a little bit about clear design and white space. On a page, this one is very dense with text. You want to leave about 20 to 35% of a page as white space, as in this example. It gives the eye a place to sort of rest between all the text, and frankly, it makes people more willing to read your material if it has enough white space. We have these overall design tips about line length, using line drawings and icons, including faces when relevant, using bold formatting and text boxes to highlight important points, and then to bold your action items. In other words, highlight somehow with color or in a box the things that you want your readers to do so that they're sure to see those. Another one, when it comes to fonts, use sentence case instead of all caps, or title case where every letter is capitalized, or almost every word is capitalized. We see that a lot in headings. Use at least a size 12 through 16 font, maybe a little bit bigger for older adults if you're doing for older adults. With this example, this is our lead poisoning example, again, from the KCHD website. And you can see that just one improvement that we can see that you could make is to just only, capitalize that first word, what, and it'll be easier to read. And the reason is because studies show that lower case letters are more easily recognizable by people with low literacy. And finally, make it personal and motivating. This is a really great post. This is just one example of a post from the KCHD website where they use a photo and a quote from a mom whose son is getting vaccinated. And it's just really effective because it's personal. And so that's a really great example. So that is the substance of the content of our training today. As we said, we will send you these resources along with a summary of the most important content that we covered today. And what questions do you all have for us just in the minute that we have left? Go ahead and unmute or put them in the chat. Okay, I'm not seeing any. Thank you. Thank you for coming. And before we go, we do have a next training next month. And we are going to, once you leave, I think, Megan, once they leave, a little survey will pop up.
Yes, please, if you, hopefully a survey should pop up when you leave the meeting. If you could fill that out quickly, we would really appreciate it. And you will be getting the summary sheet through email soon after. And then please join us for the next training, which I mentioned before will be about how to have clear health conversations.
So thank you again for joining us today. You all are so important, being on the front line of health communication, and hopefully we'll see you next month.
Thank you very much, everyone.
All right. Thanks, everybody. Have a good day.